All right, we're going to start now. Hi, Dr. Omar. Good evening.
Hello.
Yeah, hello everyone. Thank you so much for joining in.
Hi, good evening.
We are currently live on YouTube.
You okay?
All right, we're going to start now. Hi, Dr. Omar. Good evening.
Hi.
Yeah, hello everyone. Thank you so much for joining in. Hi. We are currently live on YouTube.
Hi.
You okay? All right, we're going to start now. Hi, Dr. Omar. Good evening.
Hi.
Is there an echo coming from my end, or can everyone hear me clearly? If you can just put on the chat box.
Hi.
Okay.
I will just answer that phone call and
Is there an
join
echo coming
again.
from my end? Oh, great. Thank you very much. Thank you so much, Nina. So good evening, everyone. Good evening once again. My name is Florence Isika, and I'll be your host for today. So Tointaiwo was supposed to be the host, but due to some circumstance, she won't be able to host this event, but of course she'll be joining in. So yeah, we're just going to kick start. We are going to start with this particular Bible passage that I love so much, and it's Psalm 23, which says, "The Lord is my shepherd, I shall not want." It's a very, very common Bible verse, right? But as Christians, we still need to come into acknowledgement of what that Bible passage actually means. Since God is there for us, there is absolutely nothing that the Lord cannot do for us, right? Even though we walk through the valley of the shadow of death, we walk through wilderness, we know that God is still right there by our side. So despite the situation, despite the challenges, it's not the end of the world because there is no impossibility when God is involved. So, yes, that being said, we are just going to kick off quickly. And I'm just going to do a quick introduction of the speakers. We have Dr. Omar with us, and we also have Nina with us. So if you're joining us via YouTube or via Zoom, it's so nice to have you here. And if you have any question, please feel free to drop your questions on the chat box and it's going to be addressed. So I do hope we have a lovely time tonight. Thank you, everyone. So yes, we're just going to do a little bit of introduction. So Nina, please, can you introduce yourself? And then after you, Dr. Omar will go. Thank you.
Thank you, Florence. Thanks for your amazing platform. So, my name's Nina Lemtier, and I'm a nutrition lifestyle strategist. I found myself over 10 years ago very compromised with fibroids, and it was compromising my fertility. I was having miscarriages, and I had to really support myself from a deeper level once I had the myomectomy, which was a partial myomectomy, and I was told that they would grow back and I might be able to have, children and I should see how it goes. But I decided to be more proactive so that, I could reduce the risk of reoccurrence in regards to the fibroids. And fast forward 10 years plus, healing as best as I've ever felt. And I've got 3 children, and my fibroids have been shrinking, the ones that have been left behind, and the ones that we've been able to do back. So I'm really passionate about helping women on their journeys with fibroids in particular, how they can empower themselves to reduce the occurrence and so fertility. So it's great to be here. Thank you.
Thank you so much, Nina. So really, Nina's story is one that I really can't get over with because it's actually one of inspiration. She is a fighter, and it's an absolutely absolute honor to have her here with us at every point in time. So thank you so much, Nina. So Dr. Omar, over to you. Can you just do a little
I
bit of
can't hear you.
introduction? So much, Nina. So,
Hello?
yes, I really
Hello?
can't because it's actually
Maybe
one
leave and
of
join again.
she is a fighter, and it's an absolute honor to have her here with us at every. Can you hear me now? Thank you so much, Nina. So, Dr. Omar, over to you. Can you just do a little
I
bit of
can't hear you. Hello? Hello? Hello?
If you can hear me, can you just drop in the chat so that you can hear me?
Hello?
Can you hear me now? So, Dr. Omar, over to you. Can you just- I can't.
Hello?
Okay, thank you very much. So, Dr.
Yeah,
Omar,
that's
can you
okay.
please do a little bit of
Yeah, yeah.
introduction about yourself?
Hi.
I don't know if it's just me, but I can't hear anything from Dr. Omar.
Hello?
Oh, great, sir. Great.
Hello?
Yes,
Hello?
Dr. Omar, we can hear you now.
I don't know, I can't hear you, but I'm not mute.
I can hear you now. We
Okay,
can
all
actually hear
right,
you.
that's good.
So I just wanted to do a bit of introduction about yourself
Yeah,
for those
okay.
that are meeting you for the first time.
All right. Hi, everyone. Good evening. I am a consultant gynecologist. I work currently on the private, not NHS. I have over 35 to 40 years of experience in gynecology and obstetric. And I've been doing your meeting quite few in the last few years. So I am very pleased to meet all of you. And if after the discussion you have any question, I am more than happy to answer. And today's subject is a very hot subject, and a lot of people suffering from polycystic ovarian syndrome, and it doesn't count as a serious illness, but it is basically serious for a lot of people, especially for the one who suffer mostly. And I hope we will put some highlight on and explaining what is it and make some arrangement for the management for although each woman can be treated differently according to their demand and the severity of the condition which they have. Thank you.
Thank you very much, Dr. Omar. It's an absolute pleasure to have you here with us. And
Thank you.
we look forward to having a great time. Yeah. So our time is fast spent. I'll be throwing the first question to you, Dr. Omar.
Uh-huh.
I'm sure so many of our viewers would be hearing the word PCOS for the very first time. So do you mind throwing a little bit of light on what PCOS mean?
Yeah. Polycystic ovarian, PCOS, it means polycystic ovarian syndrome and can be polycystic ovarian disease. Polycystic in the ovary is not cyst in the ovary, because a lot of sufferer, when they just tell them without any explanation, they saying that they think there is a cyst and they can come and the cyst to be removed and everything will be all right. Polycystic by nature when it is named, because when we do ultrasound, we find out there is a little tiny sacs full of fluid, but they are very, very little, like 1.5 centimeter or less sometime. Around in the past, I was trained as a 12 of those little cysts in the ovary, it means polycystic, but now they say it should be at least 20, because it's mixed up between the young girls, which they have a lot of eggs and follicle around their ovary, and the one who suffer from polycystic ovarian syndrome. But the disease is not only on the ovary. the highlight of the disease, it is basically started from insensitivity of the insulin. The insulin, which metabolize the carbohydrate and sugar. If your sugar and not metabolized properly, then it will increase weight and also prone to diabetes. In the polycystic ovarian syndrome, women, they have less sensitivity to the minimum insulin to metabolize the carbohydrate. So for that reason, the body think they have eaten a lot of carbohydrate. I give you example. For example, if the one who suffer from polycystic ovarian syndrome have a slice of bread and someone have a loaf of bread, the one who suffer from polycystic ovarian syndrome is similar that from the slice of bread, the body think that they have half of the loaf of the bread. So the insulin is increased and increased and increased. And the insulin stimulate through the gut. There is also a lot of enzyme in the gut and stimulate the ovary, the cell in the ovary to produce the male hormone. When it produces the male hormone, this male hormone is common in every woman, but will be higher than usual. So the male hormone goes to the blood. When it goes to the blood, some of them will be binded and some of them not, because we have not a binder enough, which is produced by liver, to bind to that amount of testosterone, which is called testosterone male hormone. So the rest will change to the female hormone, which is estrogen. And the female always have estrogen, but if it is too much, then thicken the line of the womb, delay the ovulation, then delay forming the follicle properly, and when delay the ovulation, then delay the period. And the period can be ranging, they never have period 28 days. The minimum the polycystic ovarian sufferer have every 35 days and can be going to every 6 months. So the thicken of the line of the womb by the estrogen, and when they have a period, it will be the heaviest period, and it take long time to. So these are the pathophysiology, we call it pathological physiology, which is happening with polycystic ovarian syndrome. So when we start trying to manage it in different way, we have to look on how to reverse those stimulation, or how to act in each woman, what to do, especially what the problem they have, which is they have psychological problem because of the hair and acne. They have a menstrual problem because they don't know when it's coming, and when it comes it's very heavy, or they have no period, which affecting them eventually on their fertility. And also if they are looking for having a family, then they are worried about the family. And the association of extra hormone, which is the testosterone, which is stimulate the follicles, which they are very sensitive also to testosterone, to make a lot of hair in unusual part of the body, like mustache, chin, around the nipple, between the belly button and the bikini line, and even the hand and leg hairs will be very, very tough. And if the woman starts shaving them, in place of one of them, it comes 3. And also it comes back very quickly. So the hair in the body and in the face, and also the 2 of them is, if it is available, we call it polycystic ovarian syndrome. What is 2? Either a hair growth, which is tough, which is hard, is like a fish bone in unusual part of the body, and if they have irregularity of the period, or the testosterone can stimulate the skin and cause acne, an eruption of acne, and causing like a vesicle and causing like a scarring of the face. This all eventually affect on the psychology of the women, because you want to go out, you want to show yourself to the people. So they are going to be psychologically affected because their hair especially in the emergency cases, if they want to go somewhere quickly and their hair in their face, they feel very, very introverted. And also the acne they suffer, especially in the teenage. When they go to school, they will be bullied by the men or other girls about the look on their skin. So these are, it's not only a period problem or the ovary problem, it has a lot of impact on other part of the body. So when we tackling the polycystic and we're trying to treat it, we have to take each side one by one. And if you want me to continue, I can continue each one by one.
Yeah, so I'm just going to come back to some of the questions. Actually, you've answered quite a lot of the questions already.
Yeah.
Yeah, but I'm just going to throw a question to Nina, and then we come back to you with the relation fertility. Yeah, thank you very much, Dr. Omar. So yes, Nina, this question is to you. As a womb care advocate, I would love you to talk about some of the patterns you see in how women experience PCOS. I mean, Dr. Omar already shed a little bit of light to this, but I would want you to share it from a womb care perspective and how PCOS affects them both emotionally and physically. You're muted, Nina.
Sorry about that. Yes. So what I tend to experience, you know, from a client perspective is what Dr. Omar really touched on is the persistence of the cyst formation, and they can be particularly painful. And then the imbalance, the hormonal imbalance being exacerbated in regards to the hair growth and that impacting confidence and skin issues and weight. Weight is a key one. Clients are, you know, in calorie deficits, really trying to work on their weight, but they're just not shifting the weight. And that impacts, you know, their confidence. And they're not, most of the time, they're also trying to conceive as well. So it's that lack of traction in regards to conception and then all those other symptoms, it can be really, really draining. As of course, once your confidence is knocked, it impacts all aspects of your life as well. So that's what I really get to see from clients.
Thank you very much for that beautiful answer, Nina. So I'm just going to direct one more question to you before I move on to Dr. Omar. So I just want you to just shed a little bit of light on how medical treatments, natural, that is medical treatments in terms of natural sense, and lifestyle changes help women with PCOS. You know, when Dr. Omar was speaking, she touched on some of the symptoms which involved acne, hair, and all of that, which makes women to feel less of themselves. So what's some of the ways in which you can balance this in order for women not to feel too pressured or guilty?
Yeah, sure. So an obvious area is looking at diet and nutrition and reducing refined sugar and processed carbs. So eating more fiber-rich foods, whole foods, you know, drinking more water with electrolytes, and just making sure sleep patterns are as consistent as they can be. I know with modern kind of lifestyle, shift work is quite common, and that can impact, you know, hormonal imbalance in an adverse way. But just looking how you can improve sleep hygiene, so like when you're going to bed, quality of your sleep. And if you are finding that you're feeling stressed or anxious, maybe due to the symptoms and the, you know, experiencing with what comes with the PCOS, just practicing self-care activities like meditation, walks, looking at how you can relax will be important just to help support mental health and hormones. So really diet, nutrition, exercise, sleep, and looking at how you can shift kind of routines that you might be accustomed to, because I think sometimes you can get quite comfortable with your routines. So looking at how you can switch them up and get into a sweat, you know, cause a bit of your body to be a bit uncomfortable in regards to like activity, that's a good way to improve your detox pathways, your lymphatic drainage system, and just help your body release the excess estrogen and all those excess hormones from your system. So that's a good way to be quite proactive as well. Oh, she Florence is still there. But maybe, okay, she's back.
Yeah, thank you so much, Nina. I couldn't hear you.
I think you are freezed.
Yeah, I think she's frozen for me as well.
I think it's freezed in her side, not us.
Am I audible now?
Yes, can hear you.
If you can hear me, just drop a message in the chat
Yeah,
that
we
you
can hear
can.
you now. Yeah, we can hear you
Okay,
now.
thank you. All right. Thank you very much, Dr. Omar. So my next question to you, Dr. Omar, is for you to just tell us how PCOS affects fertility in women.
Yeah. Basically, the PCOS, as I explained, it ended up
Did you hear my question?
Yeah. You hear me? Do you hear me?
Yes.
Yeah. It's affecting the PCOS on fertility. Yes? Yeah.
Yes, we can hear
Yeah.
you, Dr. Omar.
So there's someone is can they mute the other because there's a bit of a sound coming. Hello?
Yes, Dr. Omar, we can hear you.
There's some sound coming on a background.
Oh, is it from my end?
I don't know. Someone which is joining there is a background sound of a man.
Let me check.
Can they mute their phone? Basically, as I explained, when there is no ovulation in the PCOS suffering women, then how the pregnancy can happen, which is the main issue about the polycystic ovarian syndrome. They have a lot of follicle, there's a lot of eggs, and also their egg reserve in a polycystic people are higher than non-polycystic. But to make the egg, this egg need to come out in through the ovary and to be meeting the sperm and be fertilized. That is what is difficult to happen. Why it is not happening, as I explained, when it is a high estrogen or high testosterone, the male hormone, which avoids the ovulation. Even when the ovulation is happen, it's going to happen in a certain time, which the woman even don't know, but will be before next period by 2 weeks. And the non-having, even if the ovulation is happen, the follicle is not growing properly to make the proper egg or mature egg, and even that egg is coming out, is not going to manage the fertilization. Even if they fertilize, still they can end up with a miscarriage. So how we reverse this? What we can do, as I said, if we, as our colleague said about nutrition is a key point in polycystic ovarian syndrome. There are people going and having Weight Watcher and this and that. This is the polycystic ovarian people. They have to watch their non-carbohydrate diet, because carbohydrate and sugar is the main issue, which is not metabolized. And when there is no metabolization, as I said, increase insulin. So cutting down is not by the joke, saying, oh, I don't eat in the morning any sugar or carbohydrate, but I do in lunch or dinner. It cutting down, carbohydrate will be a treat once in a week and in a very, very small amount. So basically, in reality, it is a meat and vegetable is the best treatment, like fish, chicken, and vegetable is good. And also, as much as possible, the weight. Weight should be very, very, the polycystic people, when their weight is less than the other one, the one who have in a good shape, no overweight, they ovulate more quicker than the one which is a higher weight. Yes, maybe they have a friend, they are higher weight and they can feel pregnant easily. But if they are not polycystic, yes, they do. But if they are polycystic, they don't, because the weight, and also, unfortunately, the polycystic people, because they're not metabolizing the carbohydrate, is changed to fat. So they gain weight very quickly, but they should not blame the polycystic for gaining weight. They should blame their diet habit. So their diet is the main important thing first, and they reduce weight. Also, they have more ovulation frequently and they can be pregnant. So there was some time I could see the women, they say, I don't want to be pregnant, but they told me because I'm polycystic, I will not be pregnant. But they felt pregnant and wanted pregnancy. But still they may feel pregnant in a time when they have ovulation. But the problem is there. And some women, if they start their family early, which is very rare now, if they start in their 20s, they still have a chance to become pregnant naturally because their ovulation is better. Their quality of eggs are better. But when they decided to go for pregnancy after age of 35 or 38, that is when all the problems started, because they have no proper ovulation every month. Then the quality of the egg is not very, very good. Then the fertility will come around. But to be honest, in my experience, the easiest infertility management is the lady with the polycystic ovarian syndrome, because there are drugs which can be used to super ovulate. In place of one egg form each month, we give them a tablet which make more eggs form. When more eggs form, then there will be a chance one of them come out and fertilize. This is one of them. The other option, there is a natural sachet or a tablet which is called Emperal or inositol alpha folic. This is changed the physiology, the pathophysiology of the polycystic ovarian syndrome, regularize their period. I mean, as regular as it be, as I said, they will never be 28 days, but they can be 35, 40 days. And then the chance to become pregnant is easier. Then the other drugs which we use also naturally, we use it. It is a diabetic because it make the insulin more sensitive to be more sensitive to insulin and also to metabolize the sugar, which is called metformin. In the past, there was another option, which is now is not allowed because they say it damaged the ovary. But in my experience, in the early days when I was training, we do a laparoscopy and they call it drilling of the ovary. Then the eggs will come out and fertilize. But nowadays, the next option will be IVF. And IVF is more successful in a polycystic people than non-polycystic. Why? Because they have a lot of follicle, they end up with a lot of embryo. So even if once this failed, the second and third time will be the attempt will be better. So the fertility is easier to be treated in women between age of 25 and 35. And my advice for anyone diagnosed with polycystic, either do egg freezing if you have no proper partner to have a child of, or if you have a partner, try it for pregnancy earlier than later, if there
Thank
is
you
no
so
any
much.
other problem.
Thank you so much for
You're welcome.
Yeah, thank you so much for the thorough breakdown, Dr. Omar. You really did justice to the next couple of questions, which I wanted to ask with relation to the realistic chances of women with PCOS to conceive naturally, as well as when women should consider fertility treatments. You already mentioned that, as well as the age that most women with PCOS would most likely get pregnant. So thank you so much for that. So if you're just joining us either on Zoom or on YouTube, we are the Feminine Health and Fibroid Network, and we are discussing PCOS and fertility. So if you have any question, do well to drop it in the chat box on YouTube or on Zoom, and it's going to be given the required answers. So thank you so much once again, Dr. Omar. So
You're
to
welcome.
you, Nina. Um, so Dr. Omar shed so much light about the chances of women to get pregnant for those with PCOS. And you have also shed more light on the medical and then the natural treatments. And you've also talked about the emotional challenge women might face. So I just have this question for you, Nina. So if you could speak to yourself and to women out there for those with PCOS journey and for those who are finding it difficult to get pregnant, what are some of the things you would say to them?
Sure, yes. So really branching off of what I mentioned, I think the most one when trying to make lifestyle adjustments and diet adjustments, I think the easiest way is to just simplify your life in regards to planning better and identify areas maybe in your day-to-day activities and kind of weekly arrangements of where you might be struggling, where you're kind of reaching for maybe processed foods, where you feel quite depleted energy wise and maybe you feel quite compromised mentally, and just identifying those triggers. That will be a good place to start, because now you can put in a plan of action in regards to addressing that, maybe through the activity of meal prepping on your day off, so you can always have healthy meals available to you, and also ways to support your mental health and your mood in regards to triggers of why you're reaching for processed foods or why you're feeling stressed. So I think that's a good activity to start with. And if you're not able to put in a plan of action, seeking professional guidance through maybe a coach of some sort, just to help you with that, and then therefore you've got more accountability. Because really and truly, if you're not addressing where you've got those triggers, you might find that the whole process just gets even more frustrating in regards to, you know, addressing the main points that Dr. Omar's mentioned, like weight, you know, the foods you're eating. You do have to be very hands-on and proactive.
Yes. I'm in the.
Thank you
I'm
so
in
much,
the
Nina. So
meeting.
you just shed
Sorry.
more light on throwing more emphasis on weight. And that is going to be my next question. Because if you should take a look at the number of women out there, in Nigeria, quite a number are, you know, I don't want to make use of that word, but a lot of them are doing their best to lose weight. And most times it's just like the efforts are not yielding as much results. And you can see a lot of people telling them to make use of these natural supplements or remedies, or for some to just kill themselves in the gym just so they can lose weight. So this is just going to throw a foundation to my next question, which is, why is weight such a big conversation with PCOS? And how can you help women to stay hopeful where losing weight feels impossible?
Sure, yes.
Basically, oh, sorry.
Sorry, was that for Dr. Omar? Sorry. Go ahead, Dr. Umar.
No, go on, because more diet
Yes,
related.
actually, the question is to you, Nina.
Oh, okay. So I think they should definitely not lose hope, because more often than not, if weight is a struggle, as in you're in a calorie deficit, you know, you're really making those steps, but you're still struggling, it's just about going deeper in regards to further deficiencies and imbalances that are likely, and getting guidance with that through testing. Because, for example, like one of my clients struggled for years with not being able to lose weight, rather she was actually gaining weight, even though she was in a calorie deficit. Now, when we ran some tests, and we were able to identify the foods that were causing a high level of reactivity and were kind of contributing to further imbalances. And we removed those foods and kind of optimized her diet, and then readjusted what she was doing in regards to lifestyle. That was when her body was more in balance and was actually now allowing the excess fat to be utilized, and she was actually now losing weight. So I think it's just about realizing that there's a reason why there's a struggle, and there's that resistance, and it's just about being more open to what that is, and being more solution driven with help. Yeah, that's what I would say, because there's so much that steps you can take to support your body to lose that excess weight. You just have to explore them.
Yeah.
Thank you so much for that, Nina. Dr. Omar, do you have any other thing to add?
What Nina said, it is true, but of course we have to agree that losing weight is not just as simple as it is. And we can't just tell the women in their 30s to 40s, late find their partner or husband starting to have a family. We can't just tell them, go and lose weight for a year and come back. So we have to support them. We have to identify what they are doing wrong and quickly turn over the things, because it's the most difficult thing to tell the women, go and lose weight and you will be pregnant, you will have children. Psychological support is very important, because some people, their mental health is not good. So they eat just like they craving for certain food, and mentally they are psychologically not right, because they are thinking and pressure of the family and friend and to having children. So these all impact on their eating habit. So if we be able to support them, if we be able to just make them understand what is the problem, they can process it quicker than to be later. Yeah, diet is very important, and that is why the women with polycystic ovarian syndrome, when they become pregnant, they have a gestational diabetes. And after age of 55, also they have to check for their blood sugar is always higher, and they prone to type 2 diabetes, because then the metabolism become worse and worse. So if we can know this from the beginning, we can control later also. I always ask the women with the polycystic when they become pregnant, I say, tell your midwife that you may have a raised blood sugar during your pregnancy and affecting your baby than to be diagnosed later, because this is important to be known. In this country nowadays is a norm, but I don't know in Nigeria is a norm to be checking for blood sugar during pregnancy. But natural pregnancy still can happen. I have a polycystic ovarian syndrome, and I have 3 children. 2 of them naturally happen. But the hope is there, the possibility is there, but sometimes they don't know where is the ovulation is happening. Sometimes the partner may be abroad, may be going to the travel at the time when this woman have ovulation. But it is difficult to pinpoint it, to say, oh, that time. But there are help to make it regular and to make it easier to find out the ovulation time, and they can conceive. And as I said, if that does not happen, the most successful IVF is happen during the fertility woman is the one who have a PCOS, especially if they started before age of 38, 36. They will have more successful pregnancy than the other type, which there is no reason for it. So always, if there is a reason, the fertility treatment is better than the one who have no reason for their infertility. As far as other things which is related to fertility is normal, they will have a normal. So the hope is there. And the other thing which is important, the women came, a lot of girls coming to me and saying, oh, I don't know how was my period when I started, and I started to take pill. I had a regular period every month, and now when I stopped the pill, it became every 3 months. No, they were polycystic from the beginning. They didn't realize it. They went on the pill, and now they thought that this made the regular. The pill is only can be used for the polycystic when for contraception, or if the woman doesn't want children but want to know when is her period coming, then you can give the policy. So it is not a treatment. Some girls, they think it was regular, why now it has become irregular? Then we diagnose them. But diagnosis is now easier. To be honest, the diagnosis by symptom is much easier than ultrasound, because ultrasound in the young woman, they all look like each other. They all look like polycystic because they have a lot of eggs. But diagnosis of polycystic by symptom, which is 2 things, irregularity of the period plus hair growth in unusual part of the body, or acne. And a lot of girls, they've been around dermatologists, they've been around buying a very expensive creams and things like that. No, it is in your blood, not in your skin. The problem is the testosterone, is the estrogen, which is high, causing your skin to be oily and to have acne. So these are the things the women should know what is the problem, and to look after themselves and try to sort out. It's more or less 50-50 in the hand of the women. I know most of our food are carb, is rice, potato, all these things, but we have to be careful. We have to be careful.
Oh, thank you so much, Dr. Omar. Thank you. Thank you. That was really, really educative and insightful. And thank you for bringing in your story in between. I'm sure people out there, they are just going to be blown away, really, really, because I am, and I'm really learning a lot, particularly because I'm always taking rice and potatoes and yam, of course.
Our food
Yeah.
is all mostly, especially Nigerian, is all rice and meat.
Thank you so
Yes.
much. So Nina, just one more question for you, Nina. So, Dr. Omar already said so much in relation to the possibility of getting pregnant, even with PCOS. So, and then there's this myth going round that women with PCOS can never have children, which I'm sure has been debunked today. Very, very pretty certain that that has been debunked today. So my last question for you, Nina, would be, what are some of the little daily changes that you've seen help women with PCOS? And what is it that you're going to say to that woman out there who is facing fertility issues and she's just looking for answers?
Sure, yes. So what I would definitely say is supplementing to support the transition in regards to addressing the weight is key. That was a big thing that helped me, because you can want to make changes, like Dr. Omar said. It's not easy, once it's your lifestyle, you're in your own habits, and you might not be in the relationship that you want, etc. So looking at supplements in a way of how they can support that transition and those decisions is key, because it really makes the difference between actually following through and getting the results or not, and kind of staying stuck in cycles of maybe eating, etc. So that would be the first thing, using supplements very strategically. And then also, in regards to what supplements to take, I think in taking folate is a good one to boost fertility, and that's at the same time with addressing the diet as well. And coenzyme Q10 is a good one to take as well. And then just overall, nutrition in regards to your food. So not relying on the supplements, obviously looking at how you can increase your green leafy vegetables, like Dr. Omar said, protein, higher protein sources, so whole foods, and move away from the carbohydrates that are quite processed. So something like just switching to brown rice rather than having the white rice, and maybe sweet potato rather than like normal white potatoes. That's a great switch and alternative. So yeah, those will be the two areas: nutrition, fruit supplements to support the weight loss journey and the body, and obviously key supplements as well to boost fertility.
Look like we lost her.
Yeah, that's what I thought.
Yeah, Nina, we can't hear you anymore.
Yes, I finished. I finished. Can you hear me?
Hi, Nina.
Hi. I finished. I finished my answer. Thank you.
Yes. All right. All right. Thank you very much, Nina. So, yeah, Nina needs to leave us now, but it's been a very, very wonderful moment with you. Thank you so much for making our time, and thank you so much for sharing your story with us.
Thank you for having me. Thank you,
So,
Doctor.
Thank you.
Dr. Omar, I
Bye.
have a few more questions for you. Yeah, thank you. Thank you.
Yes.
Bye, Nina. So I have a few more questions for you, Dr. Omar. Our time is fast spent. We have just 10 minutes more. So there is this question that just came in, and just a moment. Yes. So there is this question about irregular periods and stress as well as PCOS. So she's asking if there is a way to know if irregular periods are just stress related or they are actually signs of PCOS.
It depends on their age. Regular period, which is most of the time not frequent. In PCOS, it is not frequent. It is every 45 days in the next few months after. Hello? Hello?
Yes, we can hear you,
Yeah,
Dr.
you
Omar.
hear me? Yeah. So
Yes.
irregular period, it means infrequent period. In PCOS, usually infrequent period. It's not like irregular period frequent, like every 15 day or every 20 day. Can be between 35 day to 3 months to 6 months. If they have other symptom, because sometimes thyroid problem can cause irregular period, can cause not have frequent period, can be other endocrine problem. But if they have other symptom, for example, excessive acne, not a normal acne in teenager have, or excessive growth in a mustache and chin around the nipple, around very harsh hair between the belly button and the bikini line. If they have those two, there is a higher possibility it is polycystic ovarian syndrome. But we always exclude other thing by taking a proper history from the patient. Yes, stress, of course, is stress make everything, to be honest, in our life. Can stop the period, can make the period very coming very frequently or infrequent. So if the woman always be normal and suddenly in a year or two having a lot of stress at work or in the family or bereavement or things like that, and they have lost their period, yeah, this is stress related. But if the woman started a period at age of 13 or 12, the young age, and then from age of 16 started to be not regular, coming every 2 months, every 3 months, and have other symptom with, yes, this is polycystic ovarian syndrome. But as I said, still we have to sit down with that woman and talk about it and knowing that what other symptom they have, and then we can diagnose the polycystic. Because polycystic, when we diagnose it, is not a stigma, but it is very difficult for the woman to accept. So we have to be very careful with every single woman when we diagnose or tell them, no, you don't. And I have seen quite a lot of my patients, they come, someone told them yes, the other one said no, the other one said yes, and they are confused. So we have to exclude all other problem, all other reason before we label them with polycystic. And as I said before, polycystic is not a disease you're born with. It's like shape of the nose, color of the eye. So it is the same, and 30 to 40% of the women have the polycystic. So it's a big chunk of the women. 30% of white people have, and 40% of ethnic minority, Asian, and Black people have. But unfortunately, I mean, fortunate for Black people is less, but unfortunately, they have a fibroid in the other side. So it's not fair to have two. Yeah, to have both of them. Yeah, so the diagnosis has to be made by professional person.
Oh.
Not
Thank you
just
so
by
much, Dr.
because
Omar.
the period not come. Yeah.
Yeah. Thank you so much, Dr. Omar.
Thank you.
So yeah, it's really unfair to have both fibroids and PCOS.
Yeah, you already
I totally agree with that.
enough to have.
Yeah. So there is this question that also came in, and she wants to know if it is possible to be diagnosed with PCOS even when the ultrasound looks normal. I don't know if that is possible in any way.
Yes, I have seen it very frequently. The ultrasound report, especially if it's done by radiologists, they say it's normal. But you talk to the women and you sit down with them and you can find the symptom. Yeah, it is not ultrasonically diagnosed. It is symptomatic diagnosed. Yeah.
Yeah.
It's possible even they
Thank
have
you so much.
at least every 30-day period, those people. But
Mm.
still they have a symptom of polycystic. Because there is a polycystic syndrome and polycystic disease. When it becomes too exaggerated, a lot of hair or a lot of acne, period not coming every 3 to 6 months, we call it disease, has to be treated very in a correct way. Syndrome may be just diagnosed, but other symptom is not there. They fell pregnant very easily with themselves, naturally. But because they are in a good shape, they are not overweight. They are in a good shape. They know what they're eating. So they search from the beginning. They knew what is the best for them. And that is the one with just a syndrome that's happening. But the disease when everything else exaggerates. Yeah.
Yeah. Thank you so much, Dr. Omar. So one last question for you before we wrap up. Our time is fast spent. So during the course of the conversation, you made a statement about knowing their family history when you are asking
It's
the
very
women
common.
questions. Yeah. So is it safe to say that PCOS is hereditary?
Yes. Yes. It's run in the family. It's run in the family very, very. Yes, sometime I see a young girl, they have polycystic and the mom say, we never heard about it. When they go to further, there is someone in the family, either auntie or cousin, they have it. It is hereditary. Can come sporadic without hereditary, but 90% is hereditary and cultural.
Oh. Oh. All right. Thank you so much, Dr.
Thank
Omar.
you so much. Thank you.
Just to
And if there is any
confirm that
question,
I'm
they
not
can just
missing
send
any
it by
questions.
the WhatsApp and I will answer you. Okay?
Yeah. Yeah.
Good to
Thank you
see
so
you.
much, Dr. Omar. So
Thank
yes, this
you.
is your
Have a
call
very
to
good
join our
evening.
WhatsApp community if you haven't joined. Thank you.
Thank you so much.
So
Have a good day.
yeah. Bye, Dr. Omar.
Bye. 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 Bye.
So I'm sure we had a wonderful time listening to both Dr. Omar and Nina tonight. It's been a pleasure, really. It's been insightful. And of course, it's been eye-opening. I learned a lot. I did, and I hope you also did. And I also hope all the questions were properly answered. And you can do well to join our WhatsApp community, follow us on Instagram, on Facebook, on LinkedIn at Feminine Health and Fibroid Network. And you can also do well to subscribe to our YouTube channel if you're watching us from YouTube. And we do hope we're going to see you and to talk to you some other time. So do well to drop any question you have on any of our social media platforms, and it's going to be answered by our health professionals. So thank you for joining in once again. Do have a wonderful evening. Bye, everyone.